Before we begin, I'd like to go over a few housekeeping items. This webinar is being recorded. We'll send you the recorded presentation and slide deck following today's event. Microphones are muted. However, please submit your questions anytime in the chat feature and include your email. We will also provide you with links to resources throughout the webinar to share with your community. Lastly, as a special request to our guests, if you could please keep your camera off, that would help us with our bandwidth. On today's call, our panelists will give you an update about Maryland Health Connection, the state's health insurance marketplace, what isn't changing, as well as federal changes that will affect and impact Maryland. How the Maryland Health Insurance Administration is here to support your organization and community that you serve. Ways that Maryland Health Connection will continue to partner with you and provide support to your community, followed by the last 15 minutes to answer questions typed in the chat feature. As mentioned, please include your email and list all of your questions that you have today in the chat feature. We'd like to answer all of them today, but if we run over, we'll reach out to you directly. It is my privilege to serve as moderator for today's webinar. Changes coming, healthcare updates, and resources for Marylanders. New federal changes to health insurance are coming soon. These changes will affect many Marylanders, including those within your community. We are honored to be joined today by a distinguished panel of leaders who will provide you with insight into these changes. First, we'll hear from Michelle Eberly, Executive Director of the Maryland Health Benefit Exchange. Michelle has guided the Maryland Health Benefit Exchange with a steadfast commitment to expanding access to affordable, high-quality health coverage for individuals, families, and small businesses across our state. Also with us today is Johanna Fabian Marks, Deputy Executive Director of the Maryland Health Benefit Exchange. Johanna has played a central role in shaping policy and operations to strengthen our marketplace and enhance the consumer experience. Followed by Johanna will be Marie Grant, Commissioner of the Maryland Insurance Administration. Commissioner Grant provides essential oversight of Maryland's insurance market and works to ensure fairness, transparency, and consumer protection across the industry. We are grateful for their participation today, and I look forward to their perspectives on the challenges ahead at both the federal and state levels. To begin our program, I am pleased to turn the webinar over to Michelle Eberly, Executive Director of the Maryland Health Benefit Exchange.
Thank you, Teresa, and thank you everyone for joining us today. We're so happy that you could be here to learn a little bit more about changes that are coming. There are many changes coming on the horizon, but one thing remains steady, and that is Maryland Health Connection and our Maryland Health Benefit Exchange. We are still here. We're going to talk through many federal changes today, but it's important to remember that Maryland Health Connection is here. We want you to know that you're going to be able to continue to visit marylandhealthconnection.gov to enroll in private health plans or dental plans, to apply for Medicaid, and to get connected to free help. Most importantly, please sign up for email updates so that you can stay ahead of the information as it's coming out, and we'll continue to share it. Remember, all plans on Maryland Health Connection cover preventive care, doctor's visits, hospitalization, emergency care, maternity and newborn care, pediatric care, including dental and vision benefits, prescription drugs, laboratory tests, mental health care, substance use disorder treatment, and more. That is not changing. We do have one change for 2026 in our carrier participation. Aetna is leaving the marketplace in Maryland, as in some other states this year, and we'll be sad to see them go. Will impact about 5,000 people. Now, remember, we still have 4 other carriers for folks to choose from, and we will help those 5,000 find a new health plan that meets their needs, whether it's with CareFirst, Kaiser, United, or WellPoint. Our open enrollment, we can move to the next slide. Our open enrollment is right around the corner. Now, one thing that's terrific for this year is that the open enrollment period is staying the same. We'll begin October 1st, 2025 and go right through January 15th, 2026. We anticipate having Maryland Health Connection up and ready early October for those to come in and do some shopping and see what plans are new or different and how prices will compare this year. Next slide, please. All right, so let's get into some of the changes that are affecting Maryland. We've got several things happening on the federal side, as we all know. One was there was the CMS issued the Marketplace Program Integrity Final Rule. That was June 20th of 2025. Shortly thereafter, on July 4th, the HR 1, the 2025 Budget Reconciliation Bill, was enacted. And then most important and most time sensitive right now is the elimination of the expanded premium tax credits, which are set to expire December 25th of 2025. We're going to talk about some of these issues as we go through today. And know that as a state of Maryland, we've taken a lot of action to mitigate damages as they may occur in our state, and you'll hear more about that. There's also been some legal court action that has transpired on particularly the program integrity final rule, and so that at this moment in time has stayed some of the provisions that were set to take place, and we'll talk about those too. Next slide, please. So changing this year, eligibility changes. Sadly, DACA recipients that were deemed lawfully present for the 2025 plan year, that designation was removed with the final program integrity rule. And that was effective for new enrollees in August. But for the approximately 300 Marylanders that have been able to get coverage, that coverage will end at the end of this month, September 30th. We are encouraging all DACA recipients to go utilize your coverage now while you have it. Make sure you're getting your preventive care, make sure you're getting your prescriptions, all the things that you can take benefit of before that plan ends. And we will be here alongside you to help you find other options to get you pointed in direction of where you can get coverage that might be available. The other imminent change, again, is really impacting our immigrant community, and it's the end of eligibility of financial assistance for lawfully present immigrants. These are immigrants who earn under 100% of the federal poverty level, who will no longer be eligible for advanced premium tax credits. This is effective January 1st, 2026, and we anticipate that the impact is going to be about 20,000 Marylanders. So these are folks that typically could have been eligible for Medicaid and now will not meet that or be able to get those APTCs before they're eligible for Medicaid. Again, we're here to help. While we can't provide that financial assistance, we can help you get to the right places for coverage and care. Next slide. So the other changes that are impacting us right now, the end of income verification extension. This is, while a change, it's not too bad in terms of the overall picture changes, but it was effective August 26th. So during COVID time, the 90-day period for submitting verification, documents and verification was extended by another 60 days, and that's been in place. That was removed effective August 26th and removed or reduced back to the 90-day period. So you still have 90 days to get any documents in that you need for verifications, but that extra 60 days has been rolled back. So that's important to remember. There's no longer that extended time, but within those 90 days, and again, we're here to help if you have any confusion or need clarification on what documentation needs to be submitted, what verification is outstanding, we're here to assist. And then finally, the end of the special enrollment period for low-income households. So this was another provision that was put in place where if your income was under 150% of the federal poverty level, you were able to enroll in a special enrollment based on your income. That ended August 31st. So again, anyone now who could have availed themselves of that special enrollment are no longer able to. We estimate that impact to be about 1,000 Marylanders per month who are utilizing that. This makes our open enrollment period even more important because it's going to be that time to come in and get coverage. Now, we always tell everyone, if you're in doubt, come enroll anyhow, because there are other life events that trigger special enrollment periods. So even though you may not think you're eligible for one, you might be eligible for one. Next slide, please. Eligibility changes we are monitoring. So I talked about things that were stayed in court. And one of the things that are stayed because of court action is loss of financial assistance for failure to file your taxes and reconcile your APTC. There has in the past been, if you did not file taxes and did not reconcile your advanced premium tax credits, the federal government could inform us that we would have to cease providing those advanced premium tax credits. There was some flexibility given that on this provision during COVID. It was first a year, it was expanded to 2 years. Anyhow, at this moment in time, the federal or the courts have stayed this provision. So very important to file your taxes and make sure your taxes are up to date for reconciliation, but we will not have to, at this point in time, eliminate your APTC. That could change, so please file taxes and make sure you're ahead of that for plan year 2026. Next slide, please. Some of the things that we're monitoring, again, changes in the future. We know this one as of this time will be effective for plan year 2027. We will again, not for 26, the year after. We will start open enrollment on November 1st, but it will be limited to having everything completed by December 31st. So we'll lose about 2 weeks of that open enrollment period. We'll have plenty of time to continue to get notification. And of course, we're always working on our auto renewals so that you can have an easier process. And then again, another attack on our immigrant community. Many lawfully present immigrants will no longer be eligible to get financial assistance. This becomes effective January 1st, 2027. We will be implementing it in the fall of 2026. There are also similar limits for Medicaid effective October 1st, 2026. And it really reduces the number of people that are deemed lawfully present and can get premium tax credits. So it limits it to immigrants who have green cards, who are COFA immigrant migrants, and certain immigrants from Cuba. The many lawfully present immigrants that we currently have, such as folks in refugee status, asylees, and people with temporary protected status, will be affected. There are also many changes coming for Medicaid coming in the future, and we will continue to keep folks up to date on that. We're working very closely with our Department of Health and Department of Human Services as we look at other changes that will be coming in the future. So I will stop there, and it's my pleasure to hand the mic over to Johanna Fabia Marks to discuss the impact of the federal changes and what Maryland is doing to respond.
Thank you, Michelle. So I think yes. So the big picture, the impact that we're potentially looking at for 2026 is out of the approximately 250,000 Marylanders enrolled through Maryland Health Connection, we could be looking at a projected 50,000 losing coverage. And this is a combination of a couple of reasons that go into that 50,000. We have the approximately 20,000 legally present individuals who are going to lose eligibility for federal tax credits. They can still enroll through Maryland Health Connection, but they won't be eligible for the premium tax credits. And so they would have to pay full price. These are the very lowest income legally present immigrants, so they may not be able to afford that. So 20,000 of that 50,000 is that population who may end up dropping coverage due to affordability challenges. The other 30,000 that goes into that 50,000 projection are individuals who may end up dropping coverage due to premium increases and affordability challenges of their own due to the expiration of the enhanced premium tax credits at the end of this year. And I'm going to get into more detail on that in future slides. I will also say, and again, we'll discuss this more, this number could have been a lot worse if the state had not had the foresight to take action earlier this year and set up a state premium subsidy, which is going to step in and fill the gap to some extent for that loss of federal premium tax credits. So that 50,000 number we project could have been 100,000 if the state had not come together and created the premium subsidy program that I'll get into more detail about in a couple slides. So it's a tough number to look at, but we are fortunate that Maryland has taken the action it has to make it much less bad than it could have been. Next slide. So as I mentioned, Congress has not acted to extend the enhanced premium tax credits, which are scheduled to expire at the end of this year. These tax credits make health insurance significantly more affordable for our enrollees across the income spectrum, from our lowest income to middle and higher income individuals, particularly older individuals who may have quite high premiums even at higher income levels. Without these enhanced tax credits, we will see individuals' out-of-pocket costs for their premiums increase dramatically. On average, we're expecting individuals could see up to a 68% premium increase. However, that will be mitigated by the state subsidy, as I mentioned. And as I previously mentioned, those premium increases will drive some level of enrollment losses we expect. Those enhanced tax credits have really fueled growth in the exchange. They really significantly increased affordability since Congress put them into place in 2021. We've seen a 50% increase in the number of our enrollees receiving tax credits since 2021 when these enhanced levels went into effect. At the end of this year, the tax credits will not vanish entirely. They will revert back to the lower levels they were at before 2021. So I do want to be clear that those federal tax credits are not completely disappearing, but they are going down significantly. We do hope that Congress could still act to extend those enhanced premium tax credits into 2026 and beyond. There are conversations going on at the federal level in Congress about extending those tax credits. Maryland Health Connection, in partnership with state marketplaces around the country, has been doing all we can to educate our federal leaders about the impact if these tax credits were to expire, and make sure that they really understand the value that they've brought to our enrollees in Maryland and nationally. So we hope that these will get extended, but we are not counting on it. We are taking action at the state level to mitigate the impact of their loss should they not get extended. Next slide. So that action that the state has taken, which I've mentioned, is a new financial assistance program to support Marylanders. We are one of only a handful of states in the country who have acted to put in place financial assistance to help those who will be losing the federal enhanced tax credits. So starting in 2026, the new state subsidy program will provide financial support to reduce Marylanders' premiums for those who enroll through Maryland Health Connection and earn 400% or less of the federal poverty level. Our lower income enrollees under 200% of the federal poverty level will get the most help. The state subsidy will actually fully replace the value of their lost premium tax credits, so they should not see a change in their level of financial assistance. And then for those above 200% of the federal poverty level, the state subsidy program will partially replace the financial help that the federal government has not acted to extend. For Marylanders between that 200 and 400% level, the program will generally replace 50% of the value of the tax credits they're losing. For people 200 to 250%, there's sort of a sliding scale where we phase out from that full replacement at 200% down to the 50% replacement for 250 and above. So we are putting significant state resources towards mitigating the impact of this loss of federal financial assistance. We don't have the resources at the state level to fully replace that federal assistance, but it is still a significant improvement over where folks would be absent this state program. Next slide. This is more of a pictorial chart description of what I just walked through. So you can see in those first 3 rows here labeled on the left as less than 133%, and then 133 to 150 and 150 to 200%, that the Maryland state action described in the right-handmost column is that full replacement of the value of the enhanced premium tax credits. As I mentioned, from 200 to 250% of the federal poverty level, we phase down from that full value replacement to a 50% replacement of the value, and that 50% replacement extends up to 400% of the federal poverty level. We aren't able, due to resources, to extend the state subsidy to individuals above 400% of the federal poverty level. But in Maryland, we do operate the state reinsurance program, which reduces premiums for enrollees at all income brackets, including those higher income enrollees. So those higher income enrollees do still benefit from reinsurance, which is indirectly reducing premiums by more than a third relative to where they would be if the state didn't have that program. So due to these multiple affordability programs that Maryland is operating, we do expect that we will continue to have some of the lowest premiums in the nation, even with these federal changes coming in 2026. Next slide. Here are some estimates of how much help our enrollees will get from the state subsidy. You can see that premium savings are quite significant, ranging from at the lower end $100, but up to as much as approximately $1,200 per year. And those lower income individuals, for example, you see the less than 133% or less than 150%. The reason those values are lower on the state side is that those individuals will still continue to be eligible for significant federal financial assistance, even with the changes coming. So the state program doesn't need to make up as much of a difference. I see the question here, is the state subsidy program permanent? Great question. It is only authorized for calendar years 2026 and 2027. We are hoping that in that period, Congress and the federal government would take action to extend the enhanced tax credits, even if they don't do so immediately. But yes, we only have the authority for 2 years, but we will certainly, as kind of 2026 goes on, revisit where we are and discuss with the legislature in 2027 the future of the program. I also see the question, is the state subsidy available to any lawfully present immigrants? It is only going to be available to those individuals who are eligible to receive premium tax credits. And as Michelle mentioned, that population is changing. So there will be lawfully present immigrants who are ineligible for federal premium tax credits. They would also be ineligible for the state subsidy. Unfortunately, again, due to resource constraints and some complex interactions of how the state subsidy works with federal funding that we get from the reinsurance program, we were not able to stretch state dollars to extend to those legally present immigrants losing APTC eligibility. Next slide. And we don't want it to be lost in the mix here that we are still continuing to provide extra savings to young adults. As many of you may be aware, we've operated a young adult premium subsidy program for 4 years now. And that will be folded into this broader state subsidy program. So we've got more than 50,000 young adults who are receiving extra financial help to pay for their health care. We have really seen that make a difference in our market in increasing the percentage of young adults who enroll through Maryland Health Connection. And we've done some analysis that indicates the uninsured rate among young adults has declined as a result of this investment from the state. So this state premium subsidy will be folded into the overall state subsidy. We won't be distinguishing them publicly really as 2 distinct programs. When people enroll, when they look on Maryland Health Connection, they'll just see their state premium subsidy eligibility. But our kind of behind the scenes logic will be awarding enhanced assistance to young adults so that they will still qualify for that boost in premium assistance that they're getting now next year as well. Next slide. So moving forward, we've got a number of key activities on our plate. We continue to seek guidance from CMS and look for opportunities where state flexibility can be used to ensure that our enrollees are being, as well served as we can serve them. We are working within our agency and across government with our sister agencies and with our external partners to prepare for these impacts to our consumers, systems, staff, and budget. We are implementing our state programs like our state subsidy program to try to keep Marylanders covered. And we're continuing to educate and share the importance and value of these enhanced premium tax credits for Marylanders so that to the best of our abilities, our elected officials and the public understand their value and the impact if they do end at the end of this year. And of course, we want to communicate to our partners and our enrollees. And with that, I believe that I would now like to transition to the Maryland Insurance Administration Commissioner Marie Grant, who will share how to get support from the Maryland Insurance Administration.
Great. Thanks so much, Johanna. And thank you all. Thank you to the Maryland Health Connection team for the opportunity to be here and share a little bit about the resources we have for consumers here in Maryland. Next slide, please. All right, so the MIA has an amazing consumer education and advocacy unit. And we take inquiries and then we do consumer education out everywhere in Maryland. We have a team that provides education on consumer rights and coverage issues for all types of insurance. So that's health insurance, but all the other types of insurance that impact folks' lives. We do in-person at community events, fairs, libraries, farmers markets, local agencies, and more. And we also do online presentations and webinars. And in addition, we have a lot of information online on our website, insurance.maryland.gov. So online materials as well as hard copy materials and other items to help engage consumers. We also have an amazing, relatively new resource that's about a year in. It's called the Health Coverage Assistance Team. We call it HCAT. I know, yet another healthcare acronym, but it is a great team. This team can help provide one-on-one help for consumers for questions or concerns about any type of health coverage. So not just the fully insured health benefit plans we regulate, but Medicare, Medicare Advantage, Medicaid, self-insured questions. There's really no wrong door. And the role of that team is to listen, provide information, explain how processes work, help resolve the issue if it's something that we can handle internally at the MIA, or connect the person directly to the right entity to help them. And again, HCAT is an MIA-based ally to walk with the person if they want, if they want the assistance until their questions are answered or their concerns addressed wherever possible. And organizations that help consumers can use HCAT to direct referrals, team training. Please reach out to us. We're here to help. So, and I think all our contact information is on the next slide. Yep. So here's information. You can reach the HCAT team by phone or by email, and you can also follow us on any number of social media. We are available and here to help. Next slide. I also wanted to talk a little bit about a critical role that MIA plays with insurance plans that are sold through Maryland Health Connection. Is we do have an appeals and grievances team. If a consumer gets a denial for a medical service based on medical necessity, this is the 24/7 number we have. We have a wonderful team who will help in emergency situations and also reviews situations that may not be emergent but are based on medical necessity. It's a quick turnaround and we can help again to advise consumers. Consumers do have to first exhaust in many cases a carrier's internal appeals process. But when in doubt, if there's any question, just call us and we will tell you where you need to go. Next slide. Just reiterating again, we've got that 24/7 number to provide assistance to consumers or their healthcare providers who have emergency medical necessity appeals. That's 1-800-492-6116. And then carriers themselves also need to be reasonably accessible to patients and healthcare providers 7 days a week, 24 hours a day. So if folks are having trouble, again, please call us. We're here to help. So with that, I'm going to turn it over to Teresa Battaglia at the Maryland Healthcare Connection to talk about the Maryland Health Connections community resources that are available. I think you're on mute, Teresa. Sorry.
Okay, thank you. Thank you, Marie. We really appreciate your support and collaboration and partnership with the Maryland Health Benefit Exchange. So now I'd like to talk about how the Maryland Health Connection can support you and your community members. We're here through a variety of different ways. We want you to stay updated through our website, through marylandhealthconnection.gov. We have a What's New. So please encourage your consumers, your community partners to go to our website, click on that link and review what's happening, all the changes that are happening. We encourage them to do that to have the latest information. Updates will be available in English and in Spanish, so please encourage them to go. And if they have any questions, they can certainly reach out to us. Next slide, please. These are certain ways that you can help your community prepare for some of the changes that are going to be taking place. We encourage your community members, or please do this, to file their 2024 taxes if they haven't done that already. Visit our website, marylandhealthconnection.gov, and get an estimate of their health insurance costs in October. Encourage your community members to check their MHC account regularly, just to make sure that everything is up to date, and to follow us on social media at Maryland Connect for important updates. Next slide, please. Our social media kit is so important for our partners to use and to share on their social media channels. Our social media link as our partner is important for you all to help Marylanders get the latest updates and to know about anything from changes to important information. So please go to our website and you can find our social media kit at the socialmediapresskit.com/Maryland Connect. All social media posts are available in English and in Spanish. And follow us at Maryland Connect across the media channels, social media platforms for latest updates and information. Next slide, please. And we are here to help your community in so many different ways. The many ways are basically going to our website for a list of how you can get some support. We have our Flora, who's a virtual assistant who will work with the consumer to answer questions and or chat with an expert. Encourage them to download the Enroll MHC mobile app on their smartphone, and they can easily upload documents right on their phone. We have a Broker Connect program, which is free expert help from one of our 2,000 brokers who are authorized to assist community members in 30 minutes or less. And we also have free in-person, virtual, and phone enrollment assistance by our statewide navigators and brokers. They're all there to support you, your community, our consumers to get health insurance through Maryland Health Connection. We do have our MHC call center support. So they're there during the weekday to answer questions that any of your community consumers might have concerning their enrollment or any questions that they might have about eligibility. Next slide, please. Share upcoming webinars and enrollment in virtual enrollments with your community members. Here's a list of some of the upcoming webinars beginning this month through February by visiting marylandhealthconnection.gov/events to get more information on each and to register. And please share this link on your website or social media. Next slide, please. Join us by connecting with our MHC community on WhatsApp. Simply scan this QR code and share with your community partners to get the latest updates directly to their phone. And you can also sign up for text alerts and email notifications to stay updated with the latest news and information. Next slide, please. Key resources to share. You could click on any of these links here once we share the presentation slides with you. All of these links are in PDF, so you can download them and print them out for your community members and share them. They're also in English and Spanish. These resources are also on our website, marylandhealthconnection.gov. So there's a variety of different ways that you can find resources to help your community. Next slide, please. And of course, you can always contact the Maryland Health Connection if you have any questions yourself or you need support from us. our outreach program manager, Jenny Garrison, for any questions or for collaboration or support within your community. We're eager to hear from you, and we want to work with you to make sure that our consumers understand these changes, get the help that they need, and enroll in Maryland Health Connection. Next slide, please. So now is the time for our Q&A portion of our webinar. And I see we have a couple of questions in our chat feature. If you think of any questions between now and the next few minutes that you'd like for our panelists to answer, please feel free to put them in the chat feature. Okay. This question could be for Michelle. Michelle, are navigators still available?
Navigators are still available, and they will be available through our entire open enrollment season, so they will be there to help.
Excellent, thank you. Another one for Michelle. Will auto renew be affected for plan year 26?
No, we anticipate doing the same auto renewal process we've done as in the years past.
Thank you. And I know that you had spoken about the state reinsurance program, but there is a question in the chat, just basically says state reinsurance program with a question mark. Can you explain a little bit more about that, Michelle? Or
I'm going to
Johanna?
have Johanna. Yeah, I'm going to turn that one over to
Okay.
Johanna.
Okay.
Sure. The state reinsurance program is a kind of behind the scenes affordability program that the state put into place in 2019. It's a partnership with the federal government, and it enables the state to receive federal funding. And the state also puts up some state funding towards the reinsurance program. And what the program does is it essentially reinsures the insurance companies in the individual market. So for their enrollees who are particularly high cost, typically individuals who have more than about $20,000 to $25,000 in costs in a year in claims utilization, the state picks up a portion of their costs. So the state will, at the end of the year, get a tally from the insurers of what that totaled up. Kind of runs the math, and then cuts a check to the insurers to cover a portion of their claims costs for these high cost individuals. And what that does functionally is it allows the insurance companies to reduce their premiums because the state is picking up the tab for a portion of these expensive enrollee claims costs. As a result, that's reduced premiums in the individual market by about a third relative to where they would be if the reinsurance program didn't exist, thanks to the state kind of behind the scenes covering these portions of costs. It's not something that's directly visible to any individual enrollee. No enrollee kind of gets a notice saying your costs have been covered by the reinsurance program. These amounts are accumulated, aggregated by the insurers, and the math is worked out between the insurers and the states. But that end result is that premiums are significantly reduced as a result of the program.
Thank you, Johanna. I appreciate that. Thank you. This might be for you as well, Johanna. Will there be a similar work requirement as new to Medicaid for the state subsidy?
No, that work requirement is a federally imposed requirement. The state has imposed no such requirement on financial assistance that we are offering. So it will be automatically applied to individuals who are eligible based on their income when they apply or when they renew.
Great, thank you. There might be another one for you, Johanna. Will these changes also impact pregnant individuals who do not have an immigration status to apply for Medicaid? Healthy Babies Equity Act. I think they're referring to that.
Yes, I think getting into the details of Medicaid eligibility, I'd probably rather defer to my Department of Health colleagues. So I think that's information that we will be sharing that will be on there on our websites, and we're happy to follow up to address those Medicaid specific eligibility questions after the webinar.
Okay, thank you. There's a question here. The estimate tool should be used October 1st on and not before with a question mark. Can you address that, Johanna?
I
Would that
can-
be okay? Or
Or I
Michelle?
can take that, yeah. You can use that tool now. I think typically what we do is we put what year are you looking for an estimate for. So when you go in and when we're on this 2-year thing, we're go in and make sure you're talking about what year, because people are coming in today and they may want to be looking for coverage for the rest of this year. And then October 1st, we'll have the 2026 plans and premiums loaded. So you'll select which coverage year you're looking for.
Thank you, Michelle. Is coverage for pregnant undocumented immigrants continuing?
And I think I'll repeat that.
Yeah.
No, really questions related to Medicaid eligibility, we're happy to follow up with afterwards.
Thank you, Johanna. And what is the relationship between the Maryland Insurance Administration and the Maryland Health Connection? Marie, would you like to take that one?
Sure, sure. And I'd invite Michelle and Johanna to jump in. So the Maryland Insurance Administration and Maryland Health Connection are both independent state agencies, and we are partners in regulating insurance products in the state of Maryland. So the Maryland Insurance Administration reviews rates for our ACA plans and approves them. We also, again, have a number of resources to help support consumers in educating you about some of the details about your coverage. And then when you have complaints, when you're having a problem with your carrier, please come to us and we have folks that can help you. We also investigate insurance practices and have a lot of tools to do that sort of work. I sit on the board of the Maryland Health Benefit Exchange or Maryland Health Connection in my role as insurance commissioner. But again, we are partners, and maybe I'll turn it to Michelle and Johanna to distinguish anything else they'd like to.
Yes, and I will just say again, how wonderful in Maryland that we have such a good working relationship with the Maryland Insurance Administration and Maryland Health Benefit Exchanges. Other states, it's not as wonderful as ours, so I always appreciate that. But we are a true partnership in terms of how we're looking at what the rates are going to be. MIA approves the rates. But of course, the exchange needs to understand the timeline for that so we can get things loaded into our system. Johanna and Brad, the chief actuary for MIA, work very closely on communication. So everything we do, we're trying to do in lockstep. And as Marie said, she sits on the board, so governance or looking at policy decisions. So it's a very close relationship. I would say from my perspective, the biggest difference is that the MIA is the official regulator of the carriers. While we have certain plan certification standards and things that we can do, the exchange is authorized to do. We are not the regulator of the carriers. Johanna, I don't know if you want to add anything further.
No, thank you.
Thank you both very much. This is a two-part question. How prepared are federally qualified health centers and community health clinics to serve the amount of people who will lose insurance? And part B to that question is, are they receiving any state support to provide care for the uninsured?
I'll hop in on this one just because we've been having some federal meetings that have talked about this. FQHCs also, I think, are experiencing some funding challenges from the federal government. And so they are really needed in our communities and will be critical in our communities. And we're continuing to work with our partners in advocating for continued funding from the federal level for FQHCs. I don't have any information on state support that hasn't been in my lens, and I don't know if anyone else on this, Marie or Johanna, I think that might be out of our wheelhouse.
Yeah, I think we can follow up. There are definitely resources for FQHCs through the state, including the Community Health Resources Commission. But yeah, I guess the other thing I would just chime in with is it is a concern. It is our hope that we can do as much education as state agencies, and then working with you all, our community partners, and making sure that Marylanders are educated. I think even though there's challenging times out there, there's still options, and we just want to make sure that Marylanders who can get coverage, who can afford coverage, are shopping and coming to the Health Connection to look for that coverage.
Thank you, Marie, and thank you, Michelle. Next question, will immigrants still be able to receive emergency health coverage? Go ahead.
Yeah, I think this whole suite of questions again relates to Medicaid eligibility and immigration. I think we are seeing a lot of interest in that topic, so maybe we can follow up and think about how we can get some more information out on that specific topic.
Okay, we will note that and follow up. Thank you. Where is information on the state reinsurance program and who is eligible?
You can find information on the reinsurance program on what we call our stakeholder website, where we have information for our partners that's not necessarily consumer facing. That's marylandhbe.com, I believe. Yes, marylandhbe.com. But in terms of who is eligible, again, there's no individual sees their eligibility for the reinsurance program or applies for it per se or anything like that. This is all handled kind of after the fact between the state and insurance companies, and just has the impact of reducing rates across the board by 1/3. So no one needs to worry about whether they're eligible or if they can get any discounts. It's really just a larger administrative program between the state and insurers that reduces everybody's premiums in the individual market.
Thank you, Johanna. Let's see here. How many new immigrants file their income for 2025 for the plan renewal of 2026? Who got their green card in 2025 and their income or only the retirement support from their country?
So I will say, just generally, if people are enrolled with us, they should just go through the normal renewal process. If they're already enrolled on Maryland Health Connection, they should update anything related to their immigration or income that may have changed, or if it's not changed, just verify that it's correct, and we will give them the appropriate eligibility determination. As I mentioned, no legally present immigrants are losing the ability to enroll through the exchange in 2026, but individuals at certain income levels may be losing their eligibility for financial assistance. So everyone who's enrolled, and the one exception to that is our DACA enrollees. So there are about 300 DACA enrollees who are wholly losing eligibility. Apart from those DACA individuals with DACA status, everyone who's enrolled can continue to be enrolled. It's just that their eligibility for federal financial assistance may change.
Thank you, Johanna. One more for you, Johanna. Johanna, you stated the young adult subsidy will work in conjunction with the state subsidy program. Will the consumers be able to see the difference? For example, in the past, the young adult subsidy did not have to be reconciled.
Yes, and the state subsidy also does not have to be reconciled like the young adult subsidy. Maybe to clarify this, when I say work in conjunction, really every individual who's eligible for a state subsidy will get a single state subsidy amount. For young adults who are under the ages of 38 and under 400% FPL, their state subsidy amount will be higher because we're taking kind of the baseline level of support that the state's offering to individuals of all ages, and we're plussing up that with some additional financial assistance for young adults. So they will see a higher state, we're just calling it a single state subsidy amount. They'll see a higher amount on Maryland Health Connection and on their invoices from carriers. but it will function the same as the young adult subsidy has functioned to date with no reconciliation required.
Thank you, Johanna. This might also go for you to answer. For permanent residents who may earn over 400% of the poverty level, can you please address what is the best insurance option for them, particularly if they are seniors and not eligible for Medicare or Medicaid?
They can enroll through Maryland Health Connection. They will continue to be eligible in 2026. So they can enroll now if they're eligible for a special enrollment period, or they can enroll during the open enrollment period for 2026 coverage.
Thank you. And does that mean there will be another webinar regarding the Medicaid eligibility questions?
We can certainly talk to our partners at Maryland Department of Health and see if we can do a webinar with them, or if they will do a webinar, we can certainly get information out. And Teresa, I did want to go back. There was one question that was missed, and I do want to take a moment to talk about it. So there is a question here. When I asked again estimate from Maryland Health
Yes.
Connection, a person
Yes.
called me from a .org website. Are these people
Right.
working for the state of Maryland? Are they out for themselves or helping the consumer? One thing I want to really put out there to warn everybody about is that there are an awful lot of websites out there. And so we have found websites that have our colors that, look like us. They are not MarylandHealthConnection.org. And so when you're going to our site, make sure that it is Maryland Health Connection, that it is our site. You can look at the URL and make sure that it is at MarylandHealthConnection.org. And any brokers that we use are authorized to sell through Maryland Health Connection. We have a list of those on our website. We have gotten calls from people that have thought they were on Maryland Health Connection, and it was a whole different website.
Yes.
So just know that be careful, as with everything online these days. You have to really make sure that you are where you should be. And even though it looks like it might be the right one, just double check it.
Thank you, Michelle. Yes, I highlighted that because I was going to address that as well. I know that
Teresa,
that's-
do you mind if I jump in there for just a
Please
second?
get right ahead. Yes.
Because I just like to say that the other thing I want to make clear is if folks are seeing those kinds of folks who may be masquerading as legitimate actors when they are not, please let us at the Maryland Insurance Administration know. I know that when folks at the exchange have seen those, they let us know, and we can do broader investigations, because unfortunately there are bad actors out there who do try to sell Maryland plans that don't meet Maryland law. And
Yes.
yeah.
Thank you, Marie, and thank you, Michelle. I highlighted that to address that myself because we were made aware of that, and it's important for our consumers to know our URL is .gov. Just a few more questions. I know we're down to just a few more minutes. Does Maryland Health Connection always offer better prices than if a permanent resident calls the insurance company directly, i.e. Care First? Just wondering if there's any benefit to calling an insurance company directly. Michelle,
If they're not eligible for financial assistance, there are some circumstances in which if they're looking for a specific metal level silver plan, those could potentially be a lower cost off exchange. So individuals can go directly with an insurer, but we think there's many benefits to coming on exchange, including the ability to comparison shop, get the assistance that we offer with enrolling. And you never know, you might be eligible for financial assistance and you won't find that if you enroll off exchange. So I think generally we would encourage folks to come to the connection, Maryland Health Connection, but you can always discuss with a navigator or broker what the best option for you may be.
Thank you, Johanna. There's a question here about Medicaid. Students who have multiple disabilities, have private insurance, but need much more than just general medical needs. Could the family apply for Medicaid and REM program?
I think that would be a question for our Department of Health colleagues. Again, you may
Okay.
want to follow up with the navigator or local health department or Department of Social
Sure.
Services.
Okay, thank you, Johanna. And there's one more question. How does Maryland subsidy work? Do we need to apply separately for the federal tax credit? Will the consumer just pay for part of the insurance for which has been deducted by the Maryland subsidy and federal tax credit?
Yes, the Maryland state subsidy will be automatically applied by Maryland Health Connection to eligible individual people's bills. So the premium that someone who's eligible will be automatically reduced by the amount that they're eligible for, and we'll take care of paying that subsidy amount directly to the insurer. So the insurer will be billing enrollees for their premium after deducting the subsidy cost and the benefit of the tax credit. So the enrollee should not have to do anything to get that reduction in their costs.
Thank you, Johanna. And there's the last question here is from, it's a personal isolated, I think, incident. We had run into problems with delays in receiving immigration documents from USCIS and Immigration Court, which led to immigrants missing the special enrollment period due to a change in status. How is special enrollment changing for immigrants? Can the Maryland Health Benefit Exchange consider special enrollment exemptions based on USCIS delays out of the control of the applicant?
I think in these particular circumstances, we can work with enrollees who are kind of experiencing delays outside of their control. So I would just encourage reaching out to the exchange for those special cases.
Okay. Well, thank you all. Thank you, panelists, so very much for attending today's webinar. Thank you for our attendees for taking the time to join today, this very important and informative webinar. We value your partnership in providing outreach and education to Marylanders. Your support plays a vital role in ensuring that Marylanders have access to affordable quality health insurance and the resources they need to stay healthy. Please, everyone who is here today, please feel free to reach out to us directly. We're more than happy to work with you, and we look forward to partnering with you in the future to help our Marylanders get health insurance. Thank you also very much for your time today. Greatly appreciate it, and have a good rest of your day.